The population in Europe is aging. With longer lives comes new challenges. Our heart, our bones, our brains also grow older. What if computer models, also called digital twins, could help us understand how these organs deteriorate as we grow older? In InSilicoHealth, we build computational models that represent human body function. These digital twins will provide unique insights into how our bodies age and how we can proactively improve our health at an older age. Within InSilicoHealth, 11 exceptional doctoral candidates will be trained to become the next generation of young digital healthcare professionals.
Our team is going to explain what a digital twin for health is.
We do it for different target groups. And we start with Marta and Stylianos.
They address the general public and the patients.
Let's keep it simple. A digital twin is a computer model and it allows doctors to make personalized predictions.
Yes, and it allows them to measure also something they normally couldn't. But it's maybe easier with an example. Think of a brain aneurysm. It is like a very weak and tiny bubble in a very, very small blood vessel. And if the stresses acting on the walls of the aneurysm exceed a certain value, this will cause the aneurysm to break. And this is a life-threatening emergency, obviously. It is a brain bleeding. Brain aneurysms are a massive burden in our society. It has been estimated that every 18 minutes in the world, one aneurysm breaks.
Right. And measuring if or when this will happen is really hard because we can't easily measure the stress on the wall of an aneurysm. Now imagine you have a digital copy of your own brain.
So literally not science fiction, but a copy built from your own exams and your own scan results.
Yes, exactly. This gives doctors an innovative and personalized way to measure things in your body that otherwise they could not.
Because your digital twin allows your doctor to make smarter choices.
For example, it allows doctors to see how your aneurysm might change, support surgical planning, and also test different treatments, all without any risk to you. Instead of having a one-size-fits solution, each patient gets treatment based on their own characteristics.
Of course, there are challenges. To make these digital twins reliable, engineers need lots of accurate data. We really need these models to be faithful to reality.
And of course, your data must always stay private and secure. However, the aim is simple: to give the best treatment possible to every patient.
And the good news is, we're working towards it.
Next, we have Ray and Uzaye.
They address clinicians.
Like doctors or nurses.
Okay, so maybe to start, what do clinicians actually need to know about digital twins?
A digital twin is a visual representation of a patient's organ, and it's usually made by a combination of a large sum of data gathered from, let's say, the clinical health records, MRI scans, or even clinical test results. This provides the doctor or clinician with personalized information about the patient. This is something that is quite new and we didn't really have yet. Overall, this is groundbreaking. The doctors now have information to be able to predict, help for decision making, or even have support with patient engagements. So this could be used in simulations and modeling. How is this relevant for clinicians?
Well, I think what's important about digital twins is that they allow clinicians to evaluate different treatment options without any risk. So you can decide based on a specific patient's physiology or their medical situation, you can decide which treatment is best for them. So for example, if a patient is suffering from, let's say, cardiac arrhythmia, if we have a model of the electrophysiology of that patient, we can examine how different types of pacemakers or different placements of pacemakers would affect that individual's situation. Or in the case of maybe coronary artery disease, we can simulate the blood flow in the vessel to see how different designs of different stents or different placements of stents would affect things before we then progress with invasive surgery. But I'm curious, beyond just optimizing treatment designs and deciding between different treatments, what else can digital twins do?
Glad you asked. Briefly mentioned earlier was predictive modeling. Digital twins can allow doctors to have a prediction on what might happen in the future. So let's take a heart attack, for example. If a patient suffers from a heart attack, a model, specific model, patient-specific of a heart that the doctor has might allow for them to be able to predict what might happen, let's say, in a few weeks or even months ahead. For stuff as serious as heart attacks, this is great because the doctor will be able to implement measures before anything gets more serious, like before another heart attack occurs. We can also take the brain, for example. If a doctor has a model of a patient's brain specific, they will be able to notice or have stuff implemented for Alzheimer's or dementia before they get serious, of course. For these conditions, there's no cure. So especially in cases where there is no cure, it will be important or valuable for the doctor to be able to implement measurements for symptom management or, if possible, preventative measures. Another way of this is, let's say, drug development. This isn't directly relevant to the hospitals, but new drugs and new targets is valuable for better treatments. Digital twins are able to identify or help identify new biomarkers and new targets. Again, this is valuable for anything that has no cure. So what does this mean for the future, let's say, in precision medicine?
I think we need to remember that digital twins aren't there to replace the clinician. We want them to be another tool that clinicians can draw on when they're making decisions so that they can make decisions informed by a specific patient's physiology and their medical situation. And in this way, we aim to facilitate this movement towards precision medicine, towards more personalized care. Ultimately, the goal of this research is to improve clinical outcomes. And in order to do that, we need to make sure that these models are trustworthy and reliable, and that they provide clinicians with insights that they can trust and that they can actually use in the clinic with patients.
Next, we have Karin and Joao.
They address people working in the industry. For example, companies that produce medicinal drugs.
Or even knee implants.
I was thinking about how cool it actually is that planes are such safe transportation methods, even though engineers cannot do all the safety tests in real life.
Yeah, you're absolutely right. These airline companies don't crash planes in order to test them. They create computational models or digital twins, and from that they know how they behave, and even if they don't have all the necessary information.
That approach sounds like it could also be used for other industries, such as healthcare, because in healthcare we're also often faced with the challenge that we cannot measure everything in the human body directly.
Yeah, and that's exactly what's happening. More and more healthcare companies are adopting digital twins in their work environment. Compared to traditional physical testing methods, these digital twins allow for the minimization of late-stage clinical trial failures, the acceleration of innovation, and this leads to a clear competitive advantage in the market.
But new innovations also come with challenges. I can imagine that ensuring high quality data, accuracy and strong ethical governance are important for industry to build stakeholder and patient trust.
Yeah, obviously, but there's also opportunity in that, because companies that lead in setting standards that demonstrate value in digital twins, they'll not only be keeping pace with innovation, they'll also be leading it in this fast evolving market.
As healthcare continues to be reshaped by these new digital technologies, we can more and more expect the implementation of digital twins in industry, which will lead to more personalized, effective and scalable solutions.
Exactly, and the companies that act early, they won't just be keeping up with innovation, they will be driving it. From pharmacology to orthopedics, medical imaging, and many more fields. All this while keeping in consideration patient-specific healthcare and making that an objective for the future.
Next, we have Sahar and Remy.
They address other researchers and experts in the field.
Researchers are at the front of advancing digital twin, from topics in spine biomechanics to brain modeling and cardiac blood flow simulations.
Yeah, and with these models, we're able to move beyond population averages and test hypotheses at the individual level, That way, nobody is left out of medical research.
But don't these models need to be very complex?
Yeah, that's a big challenge. We know that there's significant differences in tissue properties between patients, but then also within a single patient in their own tissues. And so capturing the differences between patients while also ensuring proper validation is not easy. And we can, let's say, build very detailed models, which yes, we can, but we then also have to think about balancing the model complexity and physiological accuracy with computational costs, which itself is very difficult.
That's right. So the key is finding simplifications that don't sacrifice model accuracy and correctness for our model specific purpose.
Exactly. The art is knowing what we're able to cut out of our models.
This is related to scaling this to larger populations. Building one digital twin is one thing, but doing this for hundreds of patients, that's a big hurdle. Generating model from imaging data requires a lot of expertise, from segmentation, assigning material properties, and running a process.
Yeah, and how practical is a digital twin simulation if it takes a doctor days or even weeks to process a single patient's data?
True. Scalability means streamlining model generation and making a smart simplification to make our model usable at scale.
Yeah, and if we just take a couple steps back, let's consider that we have a model that is both scalable and also that balances model complexity with computational cost. How do we then take this digital twin model and put it into doctors' hands and have a physician actually trust the results and use it in practice?
Totally. Trust comes from clear standards for validation, transparency about how they work, and clarity about their limits.
And without these, digital twins risk staying in the lab rather than helping patients in the clinic.
We finish with Kiera and Jingyang.
They address policymakers,
like decision makers in the government.
Kiara, we have already heard so many things about digital twins, but there are so many things we cannot do yet. What is the block in our way?
That's such a good question. There is quite some potential, but there are also unresolved challenges as of for now. For example, there is still a lack of a clear and concrete regulatory framework within the European Union. And of course, this is important because regulatory frameworks do not only guide the research and development of these technologies, but they also govern their implementation and their use. We want to ensure that there is accountability, transparency, and the protection of individual rights. You know, we are talking about really sensitive health data here. We want to protect and safeguard privacy and data use. At the same time, we want to make sure that within the research and development of digital twins, there are no, for example, embedded biases built into these models.
Yes, indeed. Basically, you are suggesting we need somebody like a role as a policymaker to make everything happen, and that's the reason we should collaborate our research and use the effort from policymakers.
Indeed, an interdisciplinary project like this can really help to gather insights from different perspectives, different academic backgrounds, and also different sides. This will be useful in order to inform what we are still missing and what is still needed. But let's not forget that there will be challenges in the future that we maybe not be able to foresee right now. So it is also important that these regulations and guidelines will be reflexive and responsive to those challenges. And another aspect that I wanted to raise is about funding. We have to make sure that there is a strategic plan in place for effective funding within the European Union. and funding towards, for example, digital infrastructure, funding towards healthcare systems in hospitals, so that we will have an accessible digital twin across Europe for everyone.
Yes, of course. But luckily, we are already in the right path and we are on the same project to do everything together. And we can make a room, make a clean path for policymakers to make a safe, effective solution for everyone.
Our InSilicoHealth candidates will move beyond a technology-driven focus. They will also be exposed to ethical, legal and societal aspects of virtual human twin technology. This will prepare them to proactively address the complexity of healthy aging from a 360-degree perspective. They will be trained to become key figures in shaping the in silico healthcare of the future, where computer models help support healthy aging.